So the symptoms I had was really bad acid reflux and sort of general nausea feeling. And then I was diagnosed with GERD, and it was pretty much interfering in everyday life for a while. And then the more and more symptoms I had, the worse it was getting. Most days I would have sort of a regurgitation followed by severe burning, and sometimes it would be so bad, just any pain relief just didn't help at all. I took omeprazole, and it was okay to start with. It would dull the symptoms and the burning, but I was still getting the regurgitation. Everything was explained really well beforehand, so I knew what to expect when I came in, and it was all very smooth and quick actually. From the minute I got here, I was taken to a room and given instructions of what to do and what would happen. The day after the operation, I felt extremely sleepy, but not really much pain. I was quite surprised actually that it was kind of not painful at all really. So the day after the operation, I had no symptoms at all, no reflux, no burning, but I was quite surprised actually. I was given lansoprazole for 2 weeks after the operation, and then after that, nothing. So the illness was hindering everyday activities, so working. By the time it got to about midday, I would have burning in my chest. Socially, when I went out, I had to avoid alcohol, or if I did have alcohol, it would be even worse and I'd end up not quite enjoying myself. Nighttime, the symptoms would be quite bad when I lay down. I would often have to try and lie on my left side, which would improve it slightly, but not really that much. I would have the acid coming up into my mouth. There was one time that I wasn't even lying down, and acid came up into my mouth and actually came out my nose. The operation has improved my life quite drastically actually. Pain-free, I don't have regurgitation, I can just get on with my life. The scars are still red, but I know that they're going to fade to white, which usually takes up to a year, but they're small.